Those who refuse to receive their first dose in the coming weeks will have to pay a new health contribution.
To vax tax or not tax, it's the hottest debate in Canada right now. After Quebec announced that it will financially penalize people who refuse to take the COVID-19 vaccination. I'm here with Sean Prue, guest columnist for the Toronto Sun, as well as Laurie Goldstein and Lauren Gunter to break this all down. And we're going to start with you, Sean. You are in favor of a vax tax. Tell us why.
I am. I have no pity anymore for people who are not getting their vaccination. You know, I come from a time and place where I saw another pandemic play out, and we were so grateful when there was a bit of medicine. It was called AZT, and it was very dangerous. It deformed you. It moved your fat around. You could grow a hump. You could grow a steel belly from this stuff. And people were just so grateful to have it. They took it anyway because it was the difference between life and death. And here we've got medicine, something that will help. And people, these entitled people, are sticking their nose up at it. And I have no patience for it at all. So you don't get to go into restaurants, you don't get to go into events, and you get taxed on it because you're spreading this around, you're causing new variants to be created. And back to the HIV analogy that I just gave you, if you, in Ontario, there was a law that if you give someone HIV and knowingly do so, you can be charged with sexual assault. So we've seen penalties for this sort of thing already where disease is concerned. It could be a lot worse than a tax as far as I'm concerned.
It's a question also of fairness for the 90% of the population who made some sacrifices. I think we owe them this kind of measure.
All right, Laurie, I'm going to throw it over to you. You're not in favor of a vax tax. Tell us why.
Well, look, first of all, I respect the other point of view. This is a fundamental battle between individual versus societal rights. And I come down on the individual rights for several reasons. In 2018, the Supreme Court of Canada made it illegal for governments to charge a mandated victim charge to criminals who had committed crimes. And they said that was so bad that it discredited justice. Okay, if we can't do a surcharge on criminals who are convicted of a crime to help them pay for what they did, then to me, to treat the unvaccinated the same way is unconscionable. Unfortunately, it isn't just elites who aren't getting vaccinated. There are all kinds of studies that show that groups like Black people, Inuit in Canada, Latinos, Arabs, tend to be more vaccine hesitant than the general public. And there are a number of experts who say if you do this, including the Canadian Civil Liberties Association, you will hurt the people that you most want to help. In terms of, I also think it violates, and this will be my final point, it violates universality. If someone who is a criminal and has had a shootout outside in a city downtown, and he shows up at an emergency ward, we give that person on the basis of universality. We treat them. We don't ask questions. The police will be called and they'll do it later. But we certainly don't, anybody who comes in once they're a patient is not someone to me that should be taxed.
These people, they put a very important burden on our healthcare network.
Lauren, thousands of Quebecers have signed up to get the vaccine since Francois Legault announced that he's going to penalize people for not getting it. I want to get your take on this.
You know, just because we're frustrated, I understand the frustrated with the unvaxxed people, especially the people who are vehemently unvaxxed, the anti-vaxxers, the people who think that there shouldn't be any kind of mandates for them. They should be able to walk wherever they want, go do whatever they want to do. I get that frustration because we've now all of us been 2 years at various levels of lockdown. Thankfully, in Alberta, we're not locked down as much as people in Ontario and Quebec are, but we're all getting frustrated with it. And I don't want to take out my frustration on people who have made a personal choice, which I think is absolutely their right to not get vaccinated. And so I think the trade-off has to be you've got ways of keeping people who are unvaccinated from infecting people who are vaccinated, which Omicron does. Omicron also, vaccinated people can infect unvaccinated people, but not in huge numbers. But the thing is, you've got people now who are unvaccinated by choice, who could be spreading this around, who could be increasing the number of cases, who could be then contributing to the number of hospitalizations and then all of the other surgeries and treatments that are being bumped aside. You can say to people like that, well, it's your right not to get vaccinated because you have the security of person under our Constitution. But that doesn't mean you have full mobility rights. There are mobility rights in the Constitution, but they have reasonable limits on them. I mean, I can't walk into just any place that I'd like to go. I can't drive across your lawn. I mean, there are all sorts of things that I can't do, even though I have full mobility rights. So you say, all right, you have to show proof of vaccination to go to a hockey game. You have to show proof of vaccination to go to a liquor store, a marijuana, a cannabis outlet, to go into a restaurant. I think that those are reasonable limits on mobility for people who've made a personal choice not to get vaccinated. And I am quite happy to live with those restrictions, but I am very much against the idea that people who do not want something injected in their bodies have to have it injected in their body.
Okay, I want to throw it back to the both of you, though. What if, let's say, we modified this tax and said, okay, you don't want to get vaccinated, no problem. But if you land up in the ER, if we have to give you extra care inside one of our hospitals, have you take a bed from someone else who may need it, we're going to charge you extra for that. How do you think that would go over? And what do you think about that?
I disagree with it because it violates universality. It takes a particular group who may have made what we think are unwise decisions. Lots of people make unwise decisions. They smoke, they're overweight. In fact, one of the key indicators of severe COVID, being hit with severe COVID, is being overweight and being obese. I wouldn't, if that kind of person comes into ER and they're struggling for breath, I wouldn't go for their credit card either.
I don't care about universality. I never have. It is not a factor in my thinking on the morality of healthcare. But if you're going to say, okay, we get to charge you extra if you are unvaccinated and you get COVID, then why not charge people extra if they didn't wear their seatbelt and their injuries in their car accident are greater than they would have been if they'd had their seatbelt on, or if they were drinking and driving, or in Lori's earlier example, they were involved in a shootout outside of a downtown business of some sort. I mean, there are all sorts of ways you could say that people are responsible in a bad way for the consequences that happen to them and land them in critical care. And maybe we should think about making people financially responsible for that. But at that point, then you have to say, okay, now you can buy private insurance to cover off those extra costs. And then you've just said, okay, we have a two-tiered healthcare system. So if you want to have that, this is, I think, a first step towards a two-tiered healthcare system.
Sean, is Francois Legault's plan going to gain traction across the rest of the country?
I hope so. I really do. I think you just pointed out all these people lined up and got their vaccines as soon as this tax was announced, and it's working. I think one of the flawed premises for me in something you said, Lauren, is that you think that people don't have a right to have something injected in their bodies if they don't want it. I don't think people's individual freedoms are their public health trumps that. I think public health and the safety of all trumps people's individual freedoms. And so I hope that they roll this out across Canada, and I hope people start paying attention and get a vaccination.
Oh, I certainly don't want to live in that society.
What about an alternative that we incentivize people instead of punishing them? If you get vaccinated, you get a tax credit.
Or a lottery ticket.
We sort of tried that in Alberta. We sort of tried that in Alberta when we hit our fourth wave in the late summer of 2021.
We can get 5 extra percentage points of the adult population to step up with this small financial incentive, this $100 card, that'll cost us around $20 million. That's real money. But that is a fraction of the cost of what it would to taxpayers to hospitalize many of them.
The government announced it would give you $100 to go and get a shot. Each of the 2 shots, in fact, you could make $200. Well, nearly every marketing professor who is worth their salt said, look, if you want to incentivize people, you've got to give them at least $500. People don't move off their couches for $100. But the thing
you know
that
who
really
you are
got
now.
people,
We're just arguing over the price.
yeah, it's a bidding competition. I mean, we're all kind of prostitutes. We just have to figure out what the price is now. But the thing that did work in Alberta was the vaccine passport, which we don't call a vaccine passport in Alberta because that's politically off the table, but it's what it is. And when you had to have a passport on your phone, a certification that you had a QR code that certified you'd had your shot, suddenly tens of thousands of new people came in. Now, I also read those stories about how thousands of people lined up under the threat of this tax. If you subtract the average number of people who daily were getting their first shots in Quebec from the numbers who signed up after the tax threat, there really were only 4,000 extra people who lined up to get their first shot after Legault's announcement. And who knows whether that was because of Legault's announcement or because Omicron is now everywhere and they're getting a little bit worried that maybe they'll get sick. We saw that too during the 4th wave in Alberta, is that people thought, okay, fine, I'll get the vaccine because it sounds like this is really dangerous now. You can't tell what's motivating people and what isn't. But I really don't like the idea of having to you disagree with the state's imperative, and so therefore you must be punished with a big tax or a healthcare charge or whatever it is, when you really should have the right to say, I don't want that in my body. But but you don't have the right to just go everywhere.
Sorry, the threat may be enough, and that may be the strategy.
Yeah. Mm-hmm.
That may be the other thing. Look, doing a law, this kind of law that is going to pass constitutional muster, it's going to be complicated. I can guarantee you there are Quebec, its legal department are looking at how they can do this. That takes time. Then it's going to be debated. The wave of Omicron may be done. So the one thing I would agree, if the threat works, fine. If the threat works and then 2 months from, and other premiers start going, well, we have to look at this. And then everybody looks at it and 3 months from now goes, no, we don't really need to do it anymore because the rates are better or we're out of the wave. That would be fine too. It's cynical, but that's how politics works.
But the threat prompts people to make a different personal choice, not coercive under the state.
Yep.
Yeah. So I was going to leave it off there with all 3 of you. Do you think this can actually stick? Do you think there's any chance that this really goes into law and that people would actually have to pay a fine?
Yes, because if Quebec decides it wants to do this, despite the fact it's clearly in violation of the Canada Health Act, the Liberal government will not raise a stink. Bill 21 clearly violates the charter, but you're not going to find Prime Minister Trudeau or anybody in the Liberal cabinet saying anything untoward about it.
This Quebec proposal is something that obviously everyone is paying attention to right now, but there are still many details to know. And the details will be important in how this works. Trudeau
and Duclos, the federal health minister, were both asked about this the other day, and they both went, I don't know. We'll have to see. We don't have many details yet. They're so afraid of offending anybody in Quebec that if this passed in Quebec, would they go? No, they would not.
It's more than that. The Toronto Sun did a poll with Maru Public Opinion. And now it came out before Quebec announced a specific initiative, but initiatives like this, 60% of, Lord and I are in the minority. 60% of Canadians favor actions like this. That is like manna from heaven for politicians. If they can do an issue, never mind people's rights. If they can do where they can get 60% support when they're only at, let's say, 30 or 45% support in terms of popular support, they're going to do it. So it's very possible it will happen because people like Lorna and I are not in the majority.
So Sean, I'm going to throw it back to you one last time. How do you think this would go down south of the border?
It wouldn't go down south of the border because their entitlement problem is 10 times bigger than our entitlement problem up here. It wouldn't go down at all. And I still can't, I'm going back to what I was saying earlier, I still can't believe that we've got to either dangle carrots or punish people to take something that is a blessing that we're lucky to have.
Okay, let us know what you think down below with a comment. Don't forget to subscribe to our YouTube channel and tweet us and Facebook us as well. Thank you.